Believe it or not, there are other things going on in the Madison area besides politics.
Yeah, that's true. The pandemic is still with us, unfortunately. New COVID hotspots are emerging, particularly in the Northeast.
Nearly every state in the country is seeing an increase in COVID and flu cases, and it's still very early in the season. UW Health Chief Quality Officer, Dr. Jeff Pothof, back with us. So these, welcome, first of all.
Yeah. Hi, Dr. Pothof.
How are you
Good to
guys?
see you.
Good. Do these increases in numbers surprise you at all?
No, this is kind of following that same story that we saw during the pandemic. So typically cases start to go up in Europe, France, Great Britain. That happened. A month later or so, we start to see cases hit Northeast United States. That's starting to happen. And then they'll do Midwest and they'll get over to the West Coast. So I think, within the next month or two, we're likely to see increased COVID cases just like they're seeing on the East Coast.
But not a huge wave.
Not a huge wave like we're talking like Delta or Omicron surges. I think when a lot of people are vaccinated, they got some immunity. But to see cases increase from where they're at right now, that would be expected.
Well, and we've always paid attention to hospitalizations and COVID deaths, and they are both declining, right?
Yeah, so those COVID deaths, that's like the lagging measure. So the typical way it goes is first you'll see an increase in positive tests, you'll see these increased cases, then you'll maybe see hospitalizations go up a little bit after that, and then after that you'll see deaths go up, and then it reverses the same way. So, cases have been down for a long time, hospitalizations had been getting a little bit lower, and now we're seeing that tail end of deaths decreasing. If we do see more cases, it's not unreasonable to think that those deaths will go up a little bit again, but hopefully not at the same rate that they did earlier in the pandemic. We're better able to treat patients with COVID this far into it.
Let's talk about the flu. It's hitting the Southeast.
Yeah, absolutely. I think, early we were looking at Australia, it didn't look good, and now it's here in the United States. If you look at the southeast United States, Tennessee, Georgia, Arkansas, they're having really high flu numbers, kind of like record-setting, kind of worst in the last 10 years. Sooner or later, that's going to come to Wisconsin. Right now, it's not too bad here, but the message there is if you haven't yet found time to go get your flu shot, this is going to be a really good year to go get it.
Do you need to do it soon, or why should you do it soon?
I would do it soon because it takes, like the COVID vaccine, a couple weeks for that protection to kick in. So you want to make sure you get your flu shot and your immunity against this strain is at its highest when you start seeing cases increase in Wisconsin. That gives you the best chance of either not getting sick or, if you do get flu, decreasing the severity of those symptoms.
And our bodies haven't been exposed to the flu virus because we've been masked up and staying 6 feet apart from each other, so we're not immune to it.
No, and we have, like, most of us will have residual immunity from when, we did have flu seasons, but it's been a while since we had a flu season. We've all been masked up, and every time the flu comes around, it's just a little bit different. There's variants, as you would say, so it's good to get these vaccines that better match the variant that's going to come and hit us this year than to rely solely on your past experiences with flu.
And this one's a good match?
So far, it seems like it's a good match.
Good news.
That is good news.
Yeah.
Jeff, see you next week.
Next week.